Hello, and welcome again to another episode on our new series on CYC MD. With me today, I'd like to welcome Dr. Emged Makarios. Welcome, Doctor.
Thank you, Mary.
Pleasure to have you. Who will be answering many of our questions that we have in regards to the heart. So I know we were talking about the topic of heart and heart disease. So what are signs and symptoms of maybe a heart attack or heart disease?
Okay, so that's a very good question because a lot of people sometimes they worry that they're having a heart attack or something related. One of the things, or one of the most common things that we all talk about for a heart attack would be chest pain. And this chest pain usually has a certain nature to it. A lot of people describe it as a heaviness on their chest. Some people will say, I feel like I have an elephant sitting on my chest. And it's this squeezing sensation that people feel. And that's one of the things that we look for. Now, when you have this sensation, like we said before, if the blood supply to the heart is compromised, that usually happens if you're exerting yourself, if you're walking quickly, if you're running, something of that sort where you're stressing, the heart. So chest pain or the squeezing sensation with exertion is really one of the classic signs of a heart attack. Now, many other things can cause these symptoms, of course, and it's sometimes a little bit hard to tease them out to figure out which is which. But some of the other associated things would be palpitations, for example, where the heart is beating quickly and you feel a lot of beating in the chest. Other things might be shortness of breath. Another thing that people describe would be a sweating sensation where they feel warm and they feel sweaty. And again, it all has to do with the blood not circulating to what it needs to circulate because the heart is undergoing a certain amount of stress related to not enough oxygenated blood getting to the muscle of the heart itself. So those are really a lot of the signs that we look at when we talk about a heart attack.
And maybe this could also interest our viewers. Should somebody feel those signs and symptoms, what can be an immediate action they can take?
So one of the things that a lot of people talk about is, of course, if you are exerting yourself or if you're running or something of that sort, if you rest and the symptoms go away, that has certain information that can give your doctor if you go to see your doctor. If you are very concerned about actually having a heart attack, then again, relating to your symptoms and, your age and, a lot of the other factors that we talked about, if you're diabetic and things like that, one of the other things you could do is take a baby aspirin.
81 milligrams.
81 milligrams, or if you only have the regular aspirin, that's fine as well. So that's the 325 milligrams. And that's, one of the things, and, I guess when we talk about, about medications a little bit, aspirin is one of, the things that we use in people who have heart disease or people who we think have heart disease because it works on the actual clotting that we talked about before that causes the plaques.
Now, we mentioned earlier about causes of heart disease, and you touched on stroke being a brain attack. Mm-hmm. So what is the difference between a stroke and a heart attack?
Very, very good question. So the brain, again, needs oxygenated blood. So if that oxygenated blood is compromised, again, meaning that the flow is not what it needs to be, then the brain tissue will suffer. And as we know, just like the heart, the brain needs a lot of oxygenated blood. In fact, the brain probably needs more oxygenated blood than the heart does. So when the brain doesn't get the amount of oxygenated blood it needs, you'll get different symptoms. Now here the symptoms are different because the brain, as opposed to the heart, controls different things. So the brain supplies the different sensory nerves and the motor nerves that supply the body. So somebody might feel weakness on their left side, their left arm, their left leg. Somebody might not feel normal sensation in parts of their body. So those are all the types of symptoms that you would feel when it comes to a stroke. But again, the actual mechanism is very similar. You have a plaque that builds up in the artery and occludes or blocks off the vessel.
Now, they say that it's a fact that heart disease affects more, is probably the number one leading cause of death among women, even greater than cancer. Why is that?
So that's also a very good question, and a lot of times, even as physicians, many years ago, when a woman would come in, and this is where some of these facts come together, is they would treat the woman maybe not as aggressively or not worry about heart disease as much as they would in men. And part of that reason is because we've known that women tend to present later in life at an older age with heart attacks as opposed to men. And part of the theories why this happens is the feeling that estrogen, where women have, it's a hormone in women's body, tends to maybe protect them from having heart disease earlier on. So that led to many physicians maybe not paying as much attention to symptoms of chest pain or something like that in a woman as they would in a man. Now that being said, men and women actually over their lifespan, if you look at it, will have similar amounts of heart disease. However, women tend to live longer than men, so again, just by the statistics of it, it's thought that maybe then, since they live longer, you would see heart disease, a little bit more often in women.
So that's why the correlation.
But regardless, across the board, for men and women, heart disease or heart attacks and strokes and cardiovascular disease are the #1 causes of death in men and women, more than cancer, more than other causes of death. So that's something, again, to keep in mind.
So what are some tests that patients can go see their doctor and take to prevent or see if they're at risk of heart disease?
Mm-hmm. So that's also very important, and we all know that we should all go to physicians for regular checkups and things, and that's probably the best test you can do, because when you go to a physician, that physician will start, even before going to any complicated or fancy test, they'll start by assessing your risk profile. So what do I mean by that? Remember, we talked before about people who have family history, for example. So when you go to your doctor will ask you, do you have a mother or father who have heart disease? He'll ask you, do you smoke? Mm-hmm. He or she will ask you, do you have diabetes? Or they'll figure out if you have diabetes by doing blood tests. They'll figure out if you have high blood pressure. As you mentioned, that's the first test that we do, is we take our stethoscope out, we start measuring the blood pressure. The doctor will listen to your heart. And there are sometimes things, we talk about murmurs, which is something, again, we can listen with the stethoscope and actually tell if there's a problem with maybe one of the heart valves in the heart or something of that sort. So that's really the main, the main test, is going to your doctor, having regular checkups and things like that. After that, if the doctor feels that there is something that has to be checked out when it comes to the heart, there are many different tests that we can do, but most people probably know about the stress test. We all talk about, getting on a treadmill and actually walking. Everybody thinks you're going to be, running a marathon on the treadmill. It actually starts pretty slowly. The treadmill starts slowly. We hook people up to an EKG, which is, again, probably even before the stress test, we do the EKG. And the EKG measures the electrical activity of the heart. I told you before that the heart has its own electrical system, and by getting this tracing, we can actually figure out sometimes if there's a problem with, part of the functioning of the heart. Once we do that, once we get on the treadmill and the treadmill, starts going faster, what we're really doing is we're really just stressing the heart. Like I told you before, the heart at rest might not have a problem, but when you stress it by walking and then progressively going faster on the treadmill, you would see that. Now, some of the other things that we do are what are called echocardiograms. So echocardiograms are actually sonograms of the heart. Everybody knows about sonograms, where you look at a baby when somebody's pregnant. This is the same thing, except now we're looking up in the chest over here where the heart is, and we look at the chambers of the heart, the pumping function of the heart, and those are the types of things that we can see. Other more, fancy tests, we can do things like CAT scans. We can do a CAT scan to actually look at the arteries of the heart. When we do a CAT scan of the heart, we give contrast, which is dye that goes in the arteries, goes into the heart, and then we take a picture of the heart. And when you take this picture of the heart, you can actually tell if there are blockages in these arteries. One of the things we did is the Brooklyn Museum had mummies, and they actually wanted to see what was inside the mummies without disturbing, the wrappings and the outside of the mummies. So we actually did CAT scans on these mummies. And, we got very nice pictures, and one of the things that interested me, of course, was the heart. And some of these actual mummies had, a heart still remaining within the chest. The mummification process, they usually took the heart out and then put it back in. But anyway, long story short, we looked at the arteries of the different parts of this mummy, some of them were very well preserved, and we found plaques in those arteries themselves. So even though the ancient Egyptians didn't have refined sugars and a lot of the fatty foods that we eat now, they still had plaques in their arteries. So even all the way back to the ancient Egyptians, we had plaques in arteries. So this is really an ancient disease that has progressed and actually maybe even gotten worse in our current times, where we don't watch as much our diet.
Should someone be concerned if, say, blood pressure or heart disease or even cholesterol runs in their family?
Absolutely. As we mentioned before, if you have a family history of heart disease, then that can actually run in the family. So if your mother or father or your siblings, for example, have heart disease, then that's something that can affect you. And it's a similar type of thing with other diseases associated with heart disease, like, for example, diabetes. High blood pressure can sometimes, run in families. So that's something to always keep in mind. And when you go and see your doctor, they will ask you about this.
Family history.
Family history is very, essential when it comes to heart disease, and that's something that, we always check about. With that in mind, that, it can be more common in somebody if they have family members that have it.
And what are medications that, people can take for, say, if they have high blood pressure or heart disease or even high cholesterol?
Okay, very good question. Sometimes the medications are a little bit, confusing in terms of all the different names and things. But just to sort of keep it easier for people, it all depends, of course, on what your doctor tells you to take. So any of these medications, you shouldn't just, start taking on your own. But one of the main medications that all people who are at risk or who have heart disease take is an aspirin. And it's usually an aspirin a day. Which is prescribed to these patients, and they take that. Now there are different other categories of medications that patients take, and one of the most common, again, is relating to blood pressure. So people who have heart disease or are at risk for heart disease will be put on a blood pressure medication, and that usually works in different mechanisms, and there are different types of blood pressure medications, but those are important. If a doctor tells you to take that once a day or twice a day or something like that, it's very important to follow the directions and not miss the doses. Now, besides the aspirin, there are other medications. So, for example, people who might have had heart attacks or strokes or things like that, they're put on other medications similar to aspirin. Mm-hmm. And those medications, sometimes if somebody has a heart attack, they have a procedure which fixes the heart, the blockage, and opens it up. Mm-hmm. Those are people who might have stents. People who have stents are put on specific medications. A stent is a metallic object that goes in and opens up a blockage in the heart. If you have that, you're usually prescribed certain medications that is very important that you don't miss, because if you do miss that, the stent can actually close up by having new blockages in there. So again, very important when a doctor tells you to take a medication, not to allow it to run out, and always go to your pharmacy and refill it if it needs to be refilled.
Right. And we know that there's many different classes of these drugs that control it, but again, your doctor will pick the best medication in that specific class according to any factors that you may have, whether you also have diabetes. Certain subclasses of medications may be better targeted for every different individual.
Exactly.
So I know many of our viewers have been waiting for our secrets to a healthier heart. So what advice can you give our viewers in regards to advice, recommendations, in regards to maintaining and keeping a healthier heart?
Okay, that's a very good question, and I know everybody thinks that these are secrets, but actually they're actually pretty obvious to everybody, and or at least should be very obvious to everybody. And this is really one of the most important things. We've talked about a lot of things today, and really one of the keys to all of this is not getting heart disease in the first place. So if you can prevent it, that's really what we target as physicians and what everybody should target, when it comes to their heart. So some of the major things that we talk about would be relating to your diet. So we talk about the diet And, even for me, growing up, I never paid attention to what I ate, and, I just did whatever. And while at a young age, that might be okay, even now we're seeing studies where, younger people are actually overweight or obese or things like that. And that's because, again, they don't watch, what they're eating, or their parents don't allow them or don't help them to watch what they're eating. So when we talk about the diet, one of the things in terms of how much we take in versus how much we put out, your diet is really a balance. So everybody knows if you put more in than you take out, then you'll have a surplus of things. So if you eat more than you expend in terms of energy, and our diet, we eat so we can produce energy. If you eat more than you expend, you will gain weight. If you gain weight, you'll get more cholesterol in the blood, you'll get heavier, you'll get less activity, which means you'll burn off less of your weight and get more weight on, and you'll become obese, and you'll have problems with heart attacks, strokes, and diabetes. So one of the initial keys is paying attention to what you take in and how much you put out. So one of the recommendations is paying attention to your caloric intake, your calories. Okay, and calories again is a measure of actually energy. It's a measure of the amount of energy in food. So when we talk about calories, usually people of the age of maybe 25 to 50 or so should take in, if you're either man or woman, about 2,000 to 2,500 calories a day. So just to put that into perspective, when we talk about, all these hamburgers and, Big Macs and this, that, and the other thing, how many calories do you think would be in a Big Mac?
I would say maybe 1,500.
Okay, it's a good estimate, and anywhere between 500 to even 2,000 calories might be in a Big Mac, depending on if you have the double Big Mac or whatever they call it.
Okay, because I pictured the cheese.
So, exactly, the cheese, the bun, all of that contributes to the amount of calories. So remember I told you your total intake for a day is almost 2,000 to 2,500, maybe 3,000 if you're very active or things like that.
The soda, not including the French fries.
Exactly. You start adding on soda, French fries, now, again, imagine.
And then a dessert.
And then a dessert, and that's only one meal. Now we talk about 3 meals in a day. Now you can see why a big number of people are actually overweight, because they go and they eat this. It's fast food. We don't think about it when we're eating. We don't pay attention to how many calories are there. And before you know it, we're wondering, why we've gained weight or why we're not losing weight and things like that. So that's really the first step, is paying attention to how much you take in. And it's very simple. If you in New York City, they have the caloric intake in any restaurant you go into, they're required to do it. When you buy foods, you'll always have those nutrition facts, so pay attention to those nutrition facts. Other things that we should pay attention to is the amount of, sugars in foods and things like that. So sugars, again, are converted to fats in the body. So the more sugar you take in, the more you can actually have problems when it comes to the amount of fat in your body. Now, so we talked about the intake, and part of the intake is also the types of food that you eat. So greasy, fried foods are obviously not very good because they actually have bad fats. Believe it or not, there are good fats and bad fats, like we talked about, good cholesterol and bad cholesterol. The bad fats contribute to the bad cholesterol, and the good fats contribute to the good cholesterol. So the types of food that you eat have to do with this. So fruits and vegetables, again, I don't have to tell everybody, we all know growing up we should eat our fruits and vegetables because they have better fats, they have less of the bad fats, the bad cholesterols and everything that we talk about, compared to, again, these processed fatty, foods that we eat.
Mm-hmm. Unfortunately, everything that's delicious has all the greasy and...
Exactly, which is what makes it difficult. However, there are certain options that we can choose where things might taste better. For example, fish might be, more healthy than, a hamburger or something. So you can have, different options. And, fishes tend to have, some of the stuff we hear about, omega-3 fatty acids. These are all the good types of fats that we talk about. And these, again, can contribute to good cholesterol as opposed to the bad cholesterol. So, those are really the main things about what we take in. So that's the first secret is your diet, paying attention to your diet and what you take in. Now, we talked about the diet and what goes in. and what comes out is the other thing. And when we talk about what comes out, we're talking about how you expend that caloric energy that you get from the food. So this is where I talk about exercise. And exercise doesn't have to mean that you go on the treadmill and you run for an hour on the treadmill and, or you run a marathon or something like that. Exercise can be as simple as walking around the block 4 or 5 times, okay? And when we talk about exercise, some people say, well, I'm always moving around at work and, I walk around a lot at work. Well, when we talk about exercise specifically, it's always something above and beyond what you normally do. So even if you're active at work, you go up the stairs 5 times a day or something like that, when we talk about exercise, we're talking about something extra, where you get your heart rate up, where you're exercising your heart muscle, which is, again, the muscle like we talked about. And the usual recommendation is about at least a half an hour, maybe 4 or 5 times a week. If you can do it more, great. And, what I find is, a lot of people, including myself, will use the excuse of, oh, I'm too busy, I get home, I'm tired, things like that. It's really regular activity. And I'm not saying that I do it, but it is really something that we should get into. And the times where I have been successful in doing it is where, I tried to fit it into my day and said, look, this half hour, I'm going to set it aside. I'm going to do some kind of exercise, whether it's a treadmill. Some people love going to the gym with somebody else. Get a partner, go to the gym with them. Exactly, a gym buddy, and you encourage each other to do that. Or a group of people. I know a group of people go to the gym and do different types of things. And we talk about cardiovascular exercise, and then there's the exercise where you lift weights and things like that. Lifting weights and doing that type of exercise is actually good too. That helps burn calories. But when we talk about cardiovascular exercise, it's the exercise where you get your heart rate up. And that's, treadmills, ellipticals, stationary bikes, or it doesn't have to be stationary bikes. I'm talking about it because it's easier. Most people go to the gym. You want to ride your bike around the block, it's the same type of thing. Things where you get your heart rate up are things where the heart muscle will be exercised. So again, 4 or 5 times a week, at least a half an hour each time, where you're having that point where your heart rate is up. So that's sort of another, type of secret, if you will. And as you see so far, these aren't really secrets. Most people know that they should exercise and watch their diet. One of the other things that we talk about, and this goes back to one of the risk factors which I actually didn't mention, is the issue of stress. So a lot of people have a lot of stress in their lives, and they have a stressful job, or they have stress at home, or we talk about type A personalities. Type A personalities are those high-strung people who are always, wanting to do something, or they're always worried about something, or they're always worrying about something. And it's actually been found that people who have that type of personality tend to have more heart attacks and strokes. And the thought about it is that when you're more high-strung or you have more stress, that has a negative impact on the cardiovascular system through different factors that we've measured in the blood and things of that sort. But suffice it to say, more stress actually is not good for the heart. So in situations where you have, people have stress, it's always a recommendation that they try to avoid that stress. And, the opposite of stress is laughter or, joyfulness or, being happy. And they found, there's some studies which actually looked at it, and they found that people who tended to be more, quote unquote, happy in their lives might have less heart attacks and strokes. And again, you might not be able to pinpoint the exact cause of that, but that's something that, people who laugh more, might have less incidence of, heart attacks and strokes. So that's something to keep in mind. And
so hearing a joke every
hearing
few
a good
hours.
joke, laughing. And believe it or not, I even read somewhere where, they say if you just smile, first of all, when you smile, the world usually smiles back. If you smile at somebody, as long as you don't do it in the subway and somebody thinks you're, what. But it's the type of thing where, it makes you actually feel better as well. A smile, if you smile, you make yourself feel better. And I know sometimes it's tough to smile, but, it's the type of thing we should all try to keep in mind and, cheer each other up. So that's really another thing. And then, of course, knowing about all the bad risk factors. So we talked about smoking. Everybody knows smoking is bad for your health. Everybody knows that using drugs is bad for your health in general and also for the heart. different types of drugs will cause some of the things that we talked about. Like, for example, medications can speed up the heart. If you speed up the heart works more, and it's like having a stress test all the time. So certain drugs can do that. Also, alcohol. And I know this is going to be a little confusing because some people say, well, a little wine is actually good for the heart. And that, while that is true, anything, obviously, that goes overboard, if you drink too much, then that becomes a problem because that will actually damage the heart. So
we say in moderation.
Always in moderation. Anything in moderation, in general, is a good rule of thumb. So that's really the thing to keep in mind with that. And then, of course, if you do have, heart disease, or if you have diabetes or some of the other risk factors, always follow the instructions of your doctor and follow the medication regimen as closely as possible, because that will prevent you from either developing a future heart attack or having problems if you've had a heart attack before. So those are really, sort of, to sum it up, the general issues when it comes to preventing future heart disease or taking care of your heart.
Well said. Thank you so much, Dr. Makarios.
Thank you very much.
We hope you enjoyed our episode today with Dr. Emged Makarios. Thank you so much again.
Thank you.
You gave us a lot of information, and just remember, it's never too late to stop a bad habit, whether it's smoking, whether it's alcohol, and to get right on board with all the advice and recommendations that Dr. Makarios just gave us at the end. A healthy heart allows for a healthy body, allows for a healthy mind. I hope you enjoyed our episode. Until next time, God bless.